Hello, I'm Dr. Ryan De Cruz, Director of Southern Dermatology in Melbourne, Victoria. I couldn't be more excited to announce the arrival of AviClear to Southern Dermatology as the first clinic in Victoria to provide this game-changing treatment that offers a drug-free solution for acne.
AviClear is the first ever and only laser that's been FDA cleared for the treatment of moderate to severe acne in all skin types. AviClear is unique because it is a laser that puts out a wavelength, a color of light, which is selectively absorbed by the sebaceous glands. That's the heart and soul of acne. There's never been a laser or device that's ever done that before. And so what it does is it actually heats up the sebaceous glands and partially destroys them. It shrinks them down. Frankly, that's how Accutane works as well, taken orally, but with all the side effects of Accutane. So we're doing this externally. So we're shrinking down the oil glands, and what happens by doing that is we decrease the bacteria that grow in there, we decrease the blackheads and whiteheads, we decrease the inflammation that's caused by overgrown oily glands, and that's how AviClear works. Well, if you shrink down the sebaceous glands, the oil glands, and you don't have all the secondary effects, the bacteria, the blockage, that makes acne better.
AviClear is a really amazing laser. It's a 1726 nanometer laser, and what that means is that it targets the oil secreting glands within your pore. So if you think of acne like a big water balloon, right? Traditionally with medications, we're squeezing out everything inside this water balloon until there's no more water balloon. But with the AviClear, what we're doing is evaporating the water, makes it very easy to get rid of that pore. I think anybody who has had stubborn acne and doesn't want to pursue medication would be a candidate for AviClear. AviClear, for me, has been a revolution not just in how I manage acne, but also in how I've experienced laser technology. I can say for the first time ever that this is the first system that literally is a no downtime laser. This is complications obviously excluded, there are caveats here, but the moment the treatment is over, there's no significant redness, there's no significant swelling, no significant downtime whatsoever. So that means every skin type is a candidate. And I mean every skin type. It means every age group that can tolerate the discomfort of the treatment is a candidate. And that's not happened before.
Eine dieser neu vorgestellten Therapien, die ich persönlich für revolutionär halte, ist ein 1726 Nanometer Diodenlaser. Dieser Laser kommt von der amerikanischen Firma Cutera und wurde in den letzten 2 Jahren wie eine warme Semmel in den Vereinigten Staaten verkauft und kommt jetzt erst nach Europa. Und wir werden eine der ersten Kliniken sein, die diesen Laser anbietet. Dieses Gerät macht einen relativ selektiven Schaden auf den Sebozyten, das heißt, es greift den Talg an. Wir erinnern uns, wir haben in der gelappten Talgdrüse jetzt die äußeren Zellen und dann gibt es eine holokrine Sekretion und dann zerfällt das Ganze und wir erzeugen das Sebum. Und das 1726 Nanometer Strahlung, die trifft jetzt das Sebum und entzieht damit quasi der Akne den Nährboden. Das heißt, das entzündliche Nährmaterial, was ja das Bakterium braucht, um die Pusten letztendlich entstehen zu lassen, wird, wenn man so möchte, zerkocht und zerschossen, wobei die Drüse in sich intakt bleibt. Natürlich ist nach einer solchen Behandlung kurzzeitig die Haut etwas trockener, aber das ist ja genau das, was man möchte.
One of the most exciting things when we evaluate new technologies to bring in our practice focuses on 2 variables. The first, of course, is the safety of a device, and the second is the efficacy. And what we find incredible and exciting is when we have a device that can balance both, meaning it's incredibly safe and well tolerated, a comfortable patient experience, but also gives us outcomes that provide meaningful clinical differences for our patients. And when we look at the data for AviClear, I think one of the most compelling parts is it's comfortable, it's 3 simple sessions, very short sessions that are well tolerated by the patient, and when we look at the clinical data, that's where the rubber meets the road and we're most excited by the outcomes that we're seeing for our patients.
We see lots of patients, some who are young who come with their parents, usually a mom, but lots are 20 and 30 and 40-year-olds who are fed up with what we have to offer them. We give them topical, irritating creams and potions. We give them antibiotics which have potential risks and side effects. Many of them want natural approaches to the treatment of acne. What could be more natural than using light to treat acne? The AviClear is the first of its kind FDA-cleared energy-based device to treat moderate to severe acne. We're talking about a device that basically has no side effects, that's very well tolerated, 3 treatments done a month apart, using an energy-based device which delivers energy to the skin and alters the sebaceous gland in the skin, which makes oil in the skin and seems to be the root cause of acne in most people. So here we have the AviClear device, no pills, no creams, no lotions, no side effects, with clearing of acne in moderate to severe cases.
Look, we're extremely excited to be the first practice in Brisbane and to be the first dermatologist in Queensland to be able to offer AviClear. Now, what we have with AviClear is now an avenue whereby we can provide long-term solutions for patients with acne in a non-pharmacological way. So we can actually reduce sebaceous gland activity, reduce acne, and do this in a way without the medication-related side effects, and patients love this.
AviClear is an FDA-approved device for moderate to severe acne patients. It's going to target the sebaceous glands of the skin, and over a session of 3 different treatments, 1 month apart, you're going to see an amazing improvement, if not complete clearance, of your acne lesions. Super important, before your AviClear treatment, expect that it's going to take around 1 hour of time. You might be a little red. The doctor or provider is going to apply water to your skin, which helps target the sebaceous gland. So expect an hour of time in the office, expect to be a little red for up to a week, and also don't forget this treatment is a series of 3. So you're not going to have clearance and you're not going to have the results with just 1 session.
So this is the first laser that has a very specific wavelength of 1726 nanometers, and this specifically targets the sebaceous follicles. So it targets the sebaceous glands, which are overproducing sebum, which causes then the production of acne. And in this way, it downregulates those sebaceous glands. And no, you will not suddenly become more dry in your life overall or have an issue, because we have so many sebaceous follicles in our skin. And downregulating those follicles that tend to be a little overactive really helps to prevent the acne from coming back.
Acne affects over 90% of the population, and until now, most of the medications we used were either topical creams or pills. Now we have a better option for you. It's called AviClear, the first and only 1726 nanometer laser for the reduction of acne for up to 2 years. AviClear is 3 simple treatments, 1 month apart, to give you a fresher face. Many patients are concerned with side effects from medications such as Accutane that lead to dryness of the eyes or skin and other untoward side effects, or the need for lab tests. We now have a solution that can clear their skin similar to the results of Accutane, but without medications or side effects.
So why is AviClear such a revolution in the acne world? Because for the first time we have a laser that targets oil production. 3 treatments, month apart, targets the sebaceous gland, shuts them down, stops them producing sebum. Now, for a mild, moderate, or even severe acne, you can do 3 courses of AviClear, shut down the oil production, and avoid having to use chemicals. The effects last more than 2 years and are equivalent to some of the strongest oral treatments.
One of the most exciting advances that's coming is AviClear. And AviClear is a very unique laser. It's once again designed from the ground up to treat acne. And it's a 1726 nanometer laser that specifically targets the sebaceous gland and stuns them and destroys them. And what this does is treat acne at the source. And so it helps clear up acne quite rapidly, comparable with the most aggressive oral treatments for acne without all the side effects of the medications. So I think this is going to be a game changer for our acne patients and a game changer for Q2.
And AviClear is a laser that targets the glands that produce the sebum, which is the oil that is produced by those glands in the face. And the problem with acne is that the oil combined with some dead cells tend to trap bacteria, and the bacteria creates that acne formation. AviClear targets those glands and it reduces their tendency to form the oil, which is the source of the problem.
We've done AviClear treatments on patients as young as 11 and as old as 40, 42 years old. So it's good for teenage acne. It's also good for adult acne. It doesn't cause any burning or redness. There's no downtime. It's a relatively short treatment. It takes about a half an hour, 45 minutes. AviClear is a permanent treatment for acne that does not require medication. It does not require any blood tests. It's really a holistic approach to treating acne because we're not burning the surface of the skin. We're not treating systemically with any medications, and we've been getting permanent results.
I'm really excited to be the first dermatologist to receive this amazing technology known as AviClear, which is the world's first platform that's a laser technology to treat active acne. What I really think will be beneficial is particularly those patients who may have been on Roaccutane and oral medications and they're now going through another recurrence and just don't really want to be on something orally. They're really desperate to get their skin back into a remission. And particularly women who may also be around that age where they're considering starting a family. This is a massive breakthrough that gives them a drug-free alternative that will be safe if they want to get pregnant. And also for those people that just really don't want to be on a prescription anymore. I'm super excited. I've heard a lot about it from my colleagues in America and how successful it's been in their clinic. And I honestly think, I hate using this term, but I'm going to say it anyway, that it's going to be a total game changer when it comes to treating active acne, particularly that inflammatory papulopustular that quite frankly, we're kind of over going down that antibiotic route. And so I'm really excited to have this in my clinic. I think it will make a lot of my patients extraordinarily happy.
AviClear is the first FDA-approved laser device to treat mild, moderate, and severe acne. It's done in 3 sessions, 30 minutes each, spaced 4 weeks apart. AviClear's technology works by specifically targeting the sebaceous glands, which is what causes sebum. So by shrinking that sebaceous gland, it helps control and suppress the oil production, which causes acne. Our clients see an 87% reduction in their acne in just 3 to 6 months after their treatment. Acne can be tough to treat, and thanks to AviClear, we now have a solution that includes no downtime. AviClear is safe, quick, and convenient. So let's reveal the you behind your acne.
This is the AviClear laser. The AviClear is brand new technology that specifically targets the sebaceous or the oil glands in the face. With repeated treatments of the AviClear laser, we are able to target those oil glands and shrink them down, thereby also improving and at times curing acne.
It was the fact that I realized that the skin is everything, and it means everything to everyone, and being able to change somebody's skin, whether it's acne or it's psoriasis or it's eczema or some sort of a rash, really changed the whole well-being of the patient. AviClear has meant everything. It has meant everything to give another option, and a really great option that does not have the side effects that some of the medications that we have out there that I've been treating patients with for the last 14 plus years. It's really, really emotional and impactful for me. Some of my patients that have gone through AviClear this past year have been my patients since I started in Reno 13, 14 years ago.